Hey folks, Rachel here, and this video goes out to my friends at Advanced Learning Institute and all the wonderful folks that I met last week at the Social Media for Healthcare Marketing Conference. It's great to be back in Houston. You can probably hear Sophie barking in the background as the garbage truck goes by, so please ignore the her having her episode. I just wanted to share some insights that I took away from the social media for healthcare marketing conference. And since we talked a lot about video, I figured what better medium to share my feedback. The first thing I want to share is I was so impressed by the people I met who are working within healthcare organizations who are really helping to bring them up to speed on the latest in social media marketing. I know personally I still have healthcare clients who want me to fax them things, so I am very well aware that healthcare is not known for being on the leading edge of technology and on especially on interactive technology like social media. And I was so impressed by people making forays into things like live video, things like sponsored content, and bringing their organizations along and getting approval and getting, of course, budget dollars to get those done. So just kudos to everyone I met who is fighting the good fight and helping bring their organizations into line with what's going on in social media. The second thing I took away is there was a lot more discussion of Twitter than I may have expected going in. I expected a lot of Facebook discussions, and we certainly had a lot of great conversation around Facebook, but a lot more around Twitter than I expected. And sometimes I look at Twitter and I say, well, they're not really innovating, and the usership is not growing that much, and kind of wondering if it's still worthwhile. But I saw some terrific results that you all reported from your Twitter initiatives, so it's kind of reinvigorated my belief in Twitter as a social media platform. And then the third thing that really impressed me was the important role of recruiting as part of our media campaigns, because as you all shared with me, there are desperate shortages in so many areas in nursing, in certain tech fields where you really need to bring people in. And that all starts with having a strong brand and being out in front of people, sharing employee stories, stuff like that. So, those are my main takeaways. Again, congratulations to ALI for a wonderful conference. I know I had a wonderful time. I loved being able to present the workshop on personas, and we had a great conversation. And really, all the sessions were just fantastic in terms of not only the information being shared from the speakers, but also being shared on the tables. I also wanted to share two suggestions that I have for next time. These are really minor things, but things that might make the conference better in the future. Number one, it would have been helpful to have the speakers' Twitter IDs included in the program so that as they're going along their presentation, I have that ID in front of me so that I can tag them in whatever I happen to be tweeting. So that would be helpful. And then I really enjoyed getting to know the people at my table and interacting with them. And maybe it might be helpful for day two to switch the tables around a little bit. So to be able to meet some new people and get some new perspectives and some new insights from the people that I am able to sit with. So that was it. I think everything else was just really spot on. Again, great mix of people, great content, great focus. I think it's wonderful to be able to focus on social media rather than talking about digital marketing or one of these really uber big topics. And I hope to be invited back again to speak in the future. So, again, thank you to ALI for a wonderful conference, and to everyone I met. It was such a pleasure spending time with you, and I hope we all keep in touch. Have a wonderful week, and I look forward to seeing you all again in the future. Take care.